Good morning. Thank you for taking your time to be with us this morning. In our experience in health issues around children, Alabama often doesn't rank as well as we would like. Today is an opportunity to celebrate a success that has had more than a decade in the making. In 1997, the Alabama legislature created the Alabama Child Death Review process, in which at the county level, in each judicial district, unexpected and unexplained children's deaths are reviewed, and based upon those reviews, opportunities for prevention and intervention are identified. In the most recent recent Kids Count data book, it was pointed out that the 1997 creation of the Child Death Review teams has had a positive impact on further reducing preventable deaths of children in our state. And in that review, we've identified a couple of things that seem to be the primary drivers, the largest causes of children's deaths. For older children, it tends to be motor vehicle accidents, and for infants, it tends to be positional sleep issues. In both cases, the identification of those causes of death have led to both policy interventions and, in one case, legislation. The graduated teen driver's license is a direct result of the identification of motor vehicle accidents as a primary cause of death among teenagers. Likewise, the realization that positional issues for young children has led to efforts to hand out cribs and for children whose families otherwise don't have a way to ensure that they have a separate sleeping space. In addition to the crib devices, also individual one-on-one training for those parents to ensure that their children are put to sleep in the proper position to minimize the risk of SIDS. Those have been extremely important interventions. I'm pleased today to be joined by Christy Mahaffey, the Executive Director of Alabama's Children First, for some comments. Christy.
Thank you, Dr. Williamson. Children First is so excited to be here, and we certainly support the work of the Child Death Review System. Children First Foundation is a nonprofit advocacy group, and what we do is we go to the State House and we advocate for laws and policies that will positively influence and impact the children of the state of Alabama. One way we do that is protecting the Children First Trust Fund. That's about $40 million a year that is allocated to state agencies for preventable measures to help our children. One of the agencies that gets that is the Alabama Department of Public Health, and we do that for the Child Death Review System. The Children First Trust Fund is one of the primary sources of funding for the Child Death Review System. Children First sits on the State Child Death Review team, and we look at the data that comes from the various counties all across the state. It is so very important, I cannot stress this enough, that our county teams do their jobs and get the data that is needed in order to send it to the state office so we can properly identify ways to prevent child death here in the state. As Dr. Williamson stated, the two most preventable causes of death in the state of Alabama are teen deaths from driving and infant-related deaths. Children First helped various state agencies as they pushed for legislation that would positively, hopefully, impact those numbers and bring child death down in the state. One that he mentioned was the strengthened graduated driver's license bill. We worked very closely with the Child Death Review team on that. We also helped sponsor a bill regarding infant death investigation. It impacts things a little bit differently. It talks about SIDS and making sure that we properly investigate child death here in Alabama under 1 year of age. We are very excited to help the Child Death Review System in any way we can. We will continue to advocate for the funding they need in order to do this vital work. And Dr. Williamson, I thank you very much.
Thank you. I think none of us expect that we can prevent every death in a child in Alabama. The whole purpose, though, of the child death review process now over the last 17 years has been to identify the most common causes of preventable death in children, to wherever possible develop policy interventions that will reduce those deaths. And in two very large areas, we have done that. Whether it is the graduated driver's license to reduce teen deaths, whether it is the effort from some of the children's advocacy groups to hand out booster seats so that young children are properly restrained, or whether it's on the issue of SIDS and sleep-related issues in children, and the efforts both at the statewide basis to hand out or to provide education to parents about correct positional sleeping, or on a more targeted pilot basis to hand out actual devices in which children can sleep so that they can have their own safe sleeping space. These are real examples of reviewing now over 4,000 infant deaths and child deaths over the last 17 years, and using that data to drive both real action and policy initiatives that have reduced deaths among children in Alabama. And we certainly are excited to be part of that process, and we really look forward to being able to take some of these initiatives statewide. You know, we had improvement in our infant mortality rate this last year, but there's so much more that can be done, focusing on ways to reduce SIDS and ensure that sleep-related issues are minimized as a cause of infant mortality, are all extremely important opportunities for Alabama and give us a chance to further reduce our infant mortality rate. So, again, thank you for being here, and with that, I'll stop and we'll take questions if there are any.
I know the efforts to reduce the child death rate are always ongoing. What are you looking forward to in the upcoming session and sessions moving forward what policies need to be put in place to help drive down those numbers?
Well, certainly one of the things that we would like to be able to do is there has been this initiative, and it was piloted with crib devices for parents who otherwise couldn't afford them, and you had co-sleeping going on, and that unfortunately does increase the risk of death in the first year of life. What we'd love to be able to do is to have the dollars to take that initiative statewide. I think that would help with our SIDS problem. I think we would continue to we would love to see more booster seats available for parents who otherwise can't afford them. I think, so that's sort of, you know, one initiative. I think there are always issues around driving. I think the things that the legislature just did to make it illegal to text and drive, that is a extremely important initiative, especially for our young people who, number one, are more computer savvy than I am and tend to text a lot more, and second, it's important because they just don't have the experience of driving that older drivers do. So I think we've seen positive results. There's more we can do. I am now pleased to be joined by Melanie Bridgeforth with Voices.
Thank you. Thank you all. So first and foremost, thank you to the Alabama Department of Public Health, Dr. Williamson, the Child Death Review System, Christy Mahaffey with Children First. We're excited to be here today to highlight what we at Voices believe to be one of Alabama's greatest success stories. Just to provide a quick background on our organization, Voices for Alabama's Children was founded in 1992 through the vision of leading child advocates who saw a need for representation for children, a voice for children at the legislature and before other decision-making bodies. And advocacy is certainly a large aspect of what we do, but it's built on a solid foundation of research. We are the home of the Alabama Kids Count data book, which provides a county-by-county analysis on child well-being. So for over 20 years, Voices for Alabama's Children, along with other organizational partners, have used data and research to really tell the story of how our children are doing. We use it as a roadmap for the issues most impacting our children, but also a benchmark for how we as a state are prioritizing those issues and what are we doing about them. So to further accentuate the purpose of our being here today, I want to give a brief historical perspective. In 1996, the Kids Count data vividly painted a picture of Alabama's child death problem. And a lot of these deaths were unexplained. Through outreach to national networks by Alabama's child advocate community and other key decision makers, the state of Alabama found a working solution, and which is why we're here today. And that solution was setting forth policy to establish the child death review system. The visionaries and authors behind this policy approach felt that surveillance and documentation of how and why Alabama's children were dying would strongly position our state to prevent these deaths. Individually, child deaths may have appeared to be isolated, but the data in Kids Count painted a very different picture. I don't want to talk about what the numbers show, but what I do want to say is that since the establishment of the Child Death Review, our data shows an over 20% decrease in preventable child deaths. And those numbers are not quite as updated as I would like to have had them. We did this before my coming on board. But even if one child, I think, is saved, that's enough. But over 20% reduction in preventable child deaths since the creation of the Child Death Review. And I think Don Williamson has mentioned a couple of other policies that came out of this particular win, but graduated teen driver's license, child passenger safety, all of these show very clearly the intersect between policy and data. And when we do, through policy, what the data shows is we have to do to protect our kids, we can make a difference. The most recent National Kids Count report showed that Alabama is trending positively on child death. That means we're staying in the race. We are doing great. We're competing with other states across the nation. And not only are we competing, but we're winning. So something that we're doing, and I believe that it is the Child Death Review system, along with a lot of the other policies that we've mentioned, is actually working to protect our kids. But the work is not yet done. Between, our support, Christy's organization, Don Williams' leadership, the Child Death Review team continuing the work, we believe that we can and we will end preventable child deaths in the state of Alabama.
Okay. Other questions?
You mentioned the 20% decrease in preventable child deaths. Can we be a little more specific about where those decreases are, and maybe if we have numbers, what kind of numbers does that 20% represent?
So our data is per 100,000, and so this year's Kids Count report showed 445 deaths. Now, this is a rate, not a percent. I do want to be clear about that. The data that we produce does not actually dissect where those deaths come into play. I think that's the beauty of having the Child Death Review system, because they are the ones that are able to sort of tease that out and look more intently at where these, where the progress is actually occurring. Richard probably would have
Do you have that data?
I do. I'll be able to provide
Yeah.
that to you, the specific numbers of child deaths reduced and a breakdown percentage-wise by cause.
Other questions? Okay. Well, thank y'all very, very much, and glad to have progress.
Absolutely. Thank you. Oh, my gosh.